Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
Well, good evening. Mike Farrell here with you, and we invite your phone calls tonight. A doctor is coming right into your house, your car, wherever you happen to be right now, and if you have any kind of symptoms that you're wondering about or whatever, it's not impossible to diagnose you over the air. Dr. Gear is pretty good at it. He can give you an idea at least where you should go with whatever your problem is, and you can learn all about that. The subject tonight, the key to longer life, science research based on steady lack of sleep, depression, old sports injuries, high blood pressure, diabetes, all these things, gut toxicity, all these things affect your brain function, they affect your health, they affect how you feel. Actually, there's a way to fix most of these things. We invite you to listen tonight and learn. Good evening, Dr. Gear.
Hello, Mike, and hello, everybody out there in Radio Land. It's so nice to be here with you today.
And good evening, Dr. Wyrick. How are you doing?
Hello.
Good evening. Okay, so the doctors are here, and they're here to help you. So we're going to see what we can do about all these different things, if they can be fixed or what you can do about it.
Mike, I want to let you know, and everybody out there in Radio Land, that my family has been practicing chiropractic and naturopathic medicine, and my two sons osteopathic medicine. We're at 99 years now. We have the accumulated knowledge of 99 years of chiropractic, naturopathic, and osteopathic medicine. It's just mind-boggling when I think back of all of the changes that have taken place in medicine from those early days to what it is today. I've got kind of a little story to tell everybody here. I'm going to start out with this. Quote, "I wish I'd known about my blood results before I got the bad news." End quote. We all hear stories from our friends about the health scares they've had in the past. Some turned out good, and some, well, you know. Right now, Dr. Wyrick and Dr. Gear want to help you because many of our friends and patients are having the same scares, and worse, often due to their insistence to only get the examinations and care for which their insurance will pay. There was a young doc that had what he considered many minor common issues that he ignored. At night, he snored like a buffalo, and his wife elbowed him all night. No big deal, right? How many people have that problem, snoring all night long?
Probably a lot.
During the day, he's busy running a short-staffed business. His newborn twins had him up at night with midnight feedings. He was sleeping less than 6 to 7 hours a night at best. Get this. His father had a massive heart attack in his early 60s while watching the Super Bowl game. Unfortunately, he never made it to find out the final score of the game. With a never-ending juggling between his business and family, he was only able to exercise once a week. But all in all, he considered himself healthy. Then it happened. In the driveway, shoveling snow. Yep, a heart attack. He was only in his late 30s with a young family. It turns out he had not had his labs checked in years, and when he did, his HDL, good cholesterol, was very low. He never realized the connection between snoring and heart attack risk. What we consider minor issues can have serious implications without the right attention. You never forget something like that. So how to determine if minor issues will turn into serious problems or not? That's what our training in naturopathic medicine is all about. Because naturopathic medicine covers chiropractic, and it covers the old-time osteopathic medicine and new-time biochemistry medicine. Dr. Weyrich, you have a tremendous education in the chemistry of the human body. I believe that study is called biochemistry, which leads us into your show segment tonight.
Well, yes. Let's talk about the kidneys and their role in anti-aging as well. So the kidneys do not get the attention they really deserve. For example, according to one of my teachers, a naturopath who specializes in urology and kidney function, Eric Yarnell, 10 times as many people die from kidney disease as die from liver disease. And according to Dr. Yarnell, the greatest expense to Medicare is kidney dialysis, which is better than the alternative, but you really don't want to go there. Let me give a simplified description of how the kidney works for our radio audience. Basically, the kidney cleans the blood of water-soluble waste products that are produced by our cells during all of our activities, whether awake or asleep even. Blood is a complex mixture of water, water-soluble materials, proteins, and cells. Some of the water-soluble material we want to keep the proper amount of, such as sodium, potassium, magnesium, calcium, and some nitrogen-containing compounds. But we don't want to keep too much of these either. One important job of the kidneys, then, is to help maintain balance in the body by keeping the proper amount and discarding into the urine what is excess. Another part of the kidney's job is to maintain water balance by controlling how much water is converted to urine. Other water-soluble materials we just want to get rid of, such as the product of drug processing in the body.
Well, Dr. Weyrich, can you describe to me and our audience in simple terms how the kidneys do this?
Well, yes. The kidney is made up of many small units called nephrons. Each nephron has 3 major parts. First, and I'm sorry for the big word, is the glomerulus. Just remember, glomerulus is the first part of the kidney. It sort of acts as a filter. And then the second part is the tubule that does most of the work of deciding what to keep and what to pass on into the urine. The tubules all drain into the urinary bladder. And finally, we have a network of blood vessels that are surrounding the glomerulus and the tubule.
Hey, now that we know the names of the parts, Dr. Weyrich, this kidney that we're dealing with, why don't we start with each one's function? So why don't you begin with the glomerulus? How does that work?
Well, as I said, the glomerulus is a filter. Blood flows into the glomerulus via arteries, and some of the water and water-soluble materials pass through the glomerulus filter into the tubule. Proteins and cells are too big and cannot pass through the glomerulus, and so they stay in the blood that flows back out of the glomerulus via veins.
So we'll talk about what can go wrong in the glomerulus and what to do about it later, but let's continue. What happens in the tubule?
Well, the tubule is surrounded by tiny blood vessels called capillaries. The tubule uses a lot of energy to run a number of special molecular pumps that move the individual dissolved substances back out of the tubule and into the blood capillaries that surround the tubule. The tubule also uses energy to pump much of the water back into the blood. This results in the urine becoming more concentrated in waste molecules, while all the good stuff is recycled into the blood.
How does the kidney know how much water, sodium, potassium, and so forth to keep, and how much to pass into the urine?
Well, the details are complicated, but there are a number of hormones that help control this, including, and I'm going to name a number of hormones that don't stress out if you don't catch all the names. Just get a feel for what's going on here. We have aldosterone.
Well, where does that come from?
Well, it's made in the adrenal glands. We have antidiuretic hormone, which is made in the pituitary gland in the brain. Angiotensin, which is made in the lungs. Our atrial natriuretic hormone, which is made in the heart, prostaglandins, which are made all over the body in many different organs, vitamin D, which is made by the joint efforts of the liver, skin, and kidneys. The sympathetic and parasympathetic nervous system also controls blood flow to the kidneys, which affects how much blood flow can flow into the glomerulus to be filtered.
And the sympathetic and parasympathetic nervous systems are affected by the spine. Treating the spine can directly improve the kidney function, as well as helping all the other organs that interact with the kidneys, including the adrenals, pituitary, lungs, heart, liver, and skin. But Dr. Weyrich, what is the bottom line?
Well, the bottom line is that the kidneys are very important and interact with many other parts of the body in order to keep our blood clean and in balance. It's very important to keep our kidneys healthy.
Well, this is quite a complex system that we need to understand. That's what we studied in school, isn't it?
Yes, and
Took us a few years to do it.
Yes, and one of the philosophies or mottos of naturopathic medicine is to treat the whole person, which means we have to understand how all the systems work together.
So how can we tell if our kidneys are having problems?
Well, most doctors order a test called the Comprehensive Metabolic Panel, or CMP, which is normally ordered every year. It measures sodium, potassium, calcium, phosphorus, protein, urea or blood urea nitrogen, BUN, and creatinine in the blood. If any of these are out of the normal range, then kidney health should be investigated further. The report also includes a number called the estimated glomerular filtration rate, or eGFR.
Boy, if you stumble on these words, what do you think our audience is doing?
Well, sometimes I'm a little bit like, was it Mel Tillis? Mike, remember Mel Tillis? He had a problem. He sang just fine, but in real life he stuttered. And I think he actually took up singing because he couldn't talk.
Well, maybe you should sing.
Well, our listeners don't want to listen to me sing.
Oh, come on.
But anyway.
So what is this estimated glomerular filtration rate? Boy, that's a tongue twister.
Well, it's how fast, it's an estimate of how well the glomerulus is doing its job.
I'm going to give you a little tune with glomerulus.
Okay, what rhymes with glomerulus? I'll pass. This means it estimates how well the glomerulus is filtering blood for the tubules to process. But it has problems.
What kind of problems does it have, Dr. Weyrich?
The problem with the eGFR, first of all, is it's an estimate calculated from a formula that is only accurate below about 30 units, or 60 units. Normal kidney function shows a measured, not an estimated glomerular filtration rate, GFR, somewhere around 120 units when accurate tests are done. But the accurate test is much harder to do than the estimated glomerular filtration rate, or eGFR, reported in the Comprehensive Metabolic Panel, or CMP.
So why is that a problem, Dr. Weyrich?
Well, the first problem is by the time the eGFR becomes abnormal, it means that the eGFR is less than 60, and over half of the kidney function has already been lost. This is too late for early interventions that would be most effective. When the glomerular filtration rate drops to less than about 15%, doctors start thinking about dialysis or kidney transplant. But hold your horses. Slow down. Don't rely on one eGFR test to decide when to do dialysis.
Dr. Weyrich, this is getting really complicated. What do you mean?
Well, remember I said that eGFR is an estimate that may not be accurate? One of my teachers, again, Dr. Eric Yarnell, gives an example of a case where a patient came to him for a second opinion after being scheduled for dialysis based on EGFR data. When Dr. Yarnell ordered a more accurate test, the situation didn't look so dire, and so he introduced naturopathic treatments designed to slow disease process and maybe even get back some lost function. Of course, the patient needed to be monitored closely. This is sometimes called watchful waiting, but was able to avoid dialysis for several additional years.
You know, Dr. Wyrick, we've had several patients who are in the same situation. The hardest thing that we doctors have to do, and this is all doctors, is to get people to change self-destructive habits. They're smoking, they're drinking alcohol, but most important, they're eating foods that make inflammation in their bodies. And that just really, really screws things up. So we have a caller. Hello, caller, you're on the air. How can we help you?
Hello, this is Dale calling.
Oh, hi, Dale.
Hello. Hey, I wanted to give you a call and tell you how much I appreciate all the hard work you've been doing on my back for me. And I have been suffering since I was in the military with my back. And the doctors at the clinics and the hospitals did not want to operate because they said if they start operating, it's going to be one operation after another. So they said, do what you can to keep walking. And I was getting in real bad shape. I was having a hard time walking. Even sitting in a chair for an hour was extremely excruciating. And so somebody told me about you about a year ago, and I went up and visited you, had a few treatments, and then this time I came back, and I have been coming up to Payson, which is 125 miles from Casa Grande. I come up once a week, and it has been such a big changing experience for me. It's been incredible. The last 2 weeks have really been fantastic. I was getting to the point I couldn't sit no more. I couldn't walk. And with all the damage plus the arthritis that's been in my spine, it was getting almost unbearable. And I was thinking at some point I might have to have an operation, which I didn't want, because it's going to be one after another if I ever have an operation. So I found out about you, and Mayo Clinic is the one that told me that they didn't want to operate because it'd be one surgery after another. And I found out about you, and it has just been a life-changing experience, let's put it that way.
Dale, do you mind if I...
4 or 5 different machines, and I come there once a week from Casa Grande.
Dale?
It has been fantastic.
Dale, do you mind if I tell the listeners a little bit more about you?
Oh, absolutely.
You don't mind? You have
No, I don't mind.
a condition known as ankylosing spondylitis. This is where the spine is growing together. You became very stiff. You couldn't bend hardly at all. Even your hip joints were getting stiff. And I said to you, it's going to take some time. We have to work with it. You have to change your diet. So we did a test on you to find out which food you shouldn't eat. And you've been watching that real close, haven't you?
Yes, I have been.
And then you started to lose some weight because you knew you had to get rid of that big belly that you had.
Yep.
And you're many years a truck driver, weren't you, cross country?
Yeah, 29 years.
Right. So you did a lot of sitting and eating at truck stops, not having good bowel movements, not having good urinary releases because you held everything inside of you until you could get from one spot to another. And the food you ate wasn't all that great by what you know today. You've learned so much in the last few months, haven't you?
Oh, it's been fantastic. I go up to Payson once a week, and you put me through all the drills and on all of the machines that I have to go on, and I've noticed a big difference starting the last 2 weeks. Incredible. I can turn my neck good. I can walk much better without all the pain. It's really been extremely noticeable last couple of weeks.
So much so that you bring a friend of yours with you. All the way from...
she comes with me. She's had problems with her jaw, and she was having a hard time talking. And she's been to chiropractors all over, She said, and I asked her to come and meet you. So you had her take a bunch of x-rays on her jaw, and you start working on her jaw, and man, she cannot believe the difference. She goes for weeks now without any pain. Before, she was even having a hard time even eating or talking. It was getting so bad.
That temporomandibular joint, that TMJ problem, it's really terrible. But it's all because the skull and the first couple of vertebrae were twisted.
That is amazing.
Yeah.
Well, I'll tell you, she sure thinks very highly of you. She told me personally that you are by far the best doctor she has ever met to be able to do anything for her. She's been to chiropractor after chiropractor. It's been incredible. And she could not get no relief, and I told her to come and see you. It's amazing what you've done. She goes for weeks, don't even know she has any pain no more. She cannot believe the difference.
That's what a testimony.
To say, she's going to be coming up to see you at least once a month.
You know, it's so wonderful to hear that, and I hope everybody out there listening also hears that and knows that this is from your heart. This is not something I asked you to do, and I didn't give you the words to do it. You wanted to tell people about this.
Oh, absolutely. It has changed me so much, even bending over and twisting in that a bit. I've got a ways to go yet, but it has been such a difference just in the last 2 weeks. Been incredible. I had a hard time sitting from Casa Grande up to Payson the entire trip without getting so uncomfortable. I barely could make the whole trip. And now I went up to visit this morning. I drove the entire way, didn't even feel a bit of pain. I could get out of my car without any pain at all. It was incredible. I can feel a big difference in me, especially my neck. My neck was getting so bad, it was clunking all the time. I could feel like something was clicking every time I turned my neck, and I was having problems with my neck getting real stiff. And you start working on that, it is incredible. I can turn my neck constantly now. I do not feel a bit of pain.
If I remember right, as a truck driver, you had to be very aware of everything around you. And with your neck pain that you were having, you couldn't turn your head properly to drive your car properly, could you?
Correct. That's correct.
It became somewhat dangerous to drive. Now, you got quite a bit of rotation capabilities, and it's getting a lot safer for you to drive.
Oh, absolutely. I mean, it is a change from night and day. It's not 100%, but it feels like 100% from what I have lived through. And I've been coming up to see you about every week for 2 months now. And, man, what a change. The last 2 weeks I've noticed such a big change. It's been incredible.
That's
it has
pretty
been
good.
well worth the trip going up the Payson every week.
That's pretty good in just 2 months' time.
Oh, it's been fantastic. Even Jan with her jaw, everything, she was having so many problems, and she's been coming to see you now, and it is such a world of difference. It is amazing. She said she goes for weeks without feeling a bit of pain anymore.
That's just
She's
awesome.
never had this for years.
Well, Dale, I thank you so very much for calling and sharing your experience with all of our listeners. We just hear this so much of the time from everybody. It's rare to...
Well, I'll tell you what, it is well worth the time and the effort to drive 125 miles one way just to have you work on me and for me to drive back every week. What I have felt the difference in my spine and my body has been incredible. It's well worth it. I got friends back home. I'm a snowbird down here. When I go back home, I got friends that drive 100 miles one way to go shopping. I drive 125 miles one way to get something done on my body so I know I can walk for the rest of my life. And it has been a totally incredible experience.
That's awesome. That's really awesome. Where's your home back in the Midwest?
I live in Upper Michigan, right under Lake Superior.
Oh, what's the name of Lake Superior? Was that the Great Blue Shining Water?
Yeah, it's the largest of the Great Lakes.
Yeah.
It's the farthest one north.
Right. I think in the Song of Hiawatha, they
Correct.
call
Yep.
Lake Superior.
Yep.
Dr. Wyrick, what was the name of Lake Superior in the Song of Hiawatha?
I'm not familiar with that.
Oh, Gitchigumi. Right. You live just underneath Gitchigumi.
Okay.
Yeah, there's a Canadian folk singer that sang a song about that.
Yeah, there was some Canadians singing about that. Yep, that's correct.
Can't think of his name right now.
Gordon Lightfoot, I think.
That's the one, yes.
Gordon Lightfoot. Yep.
Wow. Well, I'm so thankful. Thank you so very much for calling.
Well, absolutely.
And we'll see you next week with your friend, right?
Next Wednesday with my friend. I'll be there.
All right. Well, thank you very much for calling in.
Dr. Gear, I appreciate this. Everything you did for me.
Oh, you're more than welcome.
Okay, we'll see you next week.
All righty.
You know, it's what I've often said on this program is that we are so lucky to have you here. And, you know, we can get to you in 5 minutes here in Payson. And here's somebody that, you know, has to spend most of the day probably getting here and back. I personally, the kind of pain I was going through, I would have driven anywhere for help. I mean, I went to Phoenix, I went to Boston, I went, you know, everywhere to see, you know, trying to get some help. Couldn't find it. Here it was right here in my backyard with you. And that's what he is bringing out. That's why I want to tell anybody listening tonight that's having pain and having problems like this, neck or back or just about anything, it's probably connected to your spine. You really need to see Dr. Gear. We're lucky that it's so easy to go see you. And as a matter of fact, you do a consultation, an evaluation, correct?
Yes.
With a new client, and kind of give them an idea of what you think their problem is and what could be done and that kind of thing, or maybe they need to go have surgery or whatever. You'll tell them.
Well, yeah, I don't have any problem at all telling somebody they need some other type of care than the kind that we offer. But most of the time, we see people that need our type of care. Mm-hmm. After treating, you know, more than 20,000 people in my career, I keep coming back to the spine. It's not the only cause of disease by any means, but it's the most common cause. And it has so much to do with so many other ailments that a person has in their organ system of their body. By correcting the spine, we get rid of the core of the problem with the nervous system, which affects the blood flow in all the different organs of the body. And then the chemistry that Dr. Wyrick works with changes the blood content so that the chemistry can work better in the body, because we made it possible for the blood to carry the chemistry to all the organs in a timely manner. Now, Dr. Wyrick, you were talking a lot about the kidney and the glomerular filtration rate, and we were up to the point where I was going to ask you, is it possible to reverse kidney disease?
Well, not exactly. At any given time, there are 3 basic kinds of nephrons. Now, remember, the structures are made up of a glomerulus and a tubule. Do we have another caller?
Yes, we have another caller. Hello, caller. You're on the air. How can we help you?
Hi. My name is Catherine. I promised you, Dr. Gear, that I would call in, finally, after several thoughts that I might do so. So I'm calling in tonight, and I just want to say, and I have to tell you, I got a little teary-eyed, but I will tell the listeners that I started going to Dr. Gear in 2016. At that time, I could barely get out of bed. I hike, I bike, I kayak. I'm pretty active. So to not be able to get out of bed was pretty difficult for me after a broken foot. So this last weekend, I fell once again on the trail. I had a root sticking up out of the ground, and I called Dr. Gear that morning about 8:30, and I said, I need you to fix me. And I go in there, and he fixes me. And he's done it time after time after time again. And I can't tell you how brilliant Dr. Gear is and how important it is that you consider seeing him. If you've got, whether it's an orthopedic problem, and that's generally where they show up, but if you've got other health issues you can't figure out, at least go in and give him a try, because he knows a lot about other systems besides the skeletal system. So that's all.
Wow. You know, I had a little quip that I was going to talk about your tripping on the root just recently. Let me see if I can find that. Here in my notes. Let's see. Dr. Wyrick, you stay on the line, and Dr. Wyrick, why don't you talk a little bit more about this while I'm looking, okay? About
Okay.
your kidney problem.
Okay, so we're talking about the different kinds of nephrons. So there are healthy, functional nephrons that we want to keep healthy. There are dead nephrons that have turned into scar tissue, and they're beyond our help. But there's a third kind of nephron in the middle, nephrons that are struggling to survive, and they're not working properly. If we can help these, we can restore some lost function. And you might ask, how do we do that? Well, the first step is to accurately diagnose the cause of the kidney damage and aggressively treat the cause, because time lost is tissue lost. This is sometimes called removing obstacles to cure. After that, there are various herbs and other naturopathic treatments that can help revive the struggling nephrons. In particular, there are several herbs that have been described by another one of my teachers, David Winston, who is a registered herbalist and also a Cherokee medicine man. And he has described a number of what are called tropho-restorative herbs. That is, they restore organ systems' function. They promote the repair of damaged tissues.
That's really interesting, Dr. Wyrick. I found my notes here on our caller. You still there?
I am.
All right. So now I'm not sure if I have the right number here, but I said a 70-year-old. Is that how old you are?
I'm sorry, say that again?
Are you 70 years old?
No, I'm 68 and a half.
Okay. So anyway, you'd been hiking on a trail in Payson, and your toe hit a root. You fell forward, landing in a twisting manner on your knees, right elbow, and hand. You protected your face, but in the process you jammed your right shoulder. She's a knowledgeable patient of ours and said to herself, I quote, I am not going to the urgent care or the hospital ER to be given drugs. I'm going to Dr. Gear to get put back together, end quote. Sure enough, a quick examination showed no fractures, a few scrapes, which she said were nothing. Then all of the joint jamming and twisting was found and the fixations were released. She was no longer in, quote, capital letters pain, end quote. She still had some soreness, but the pain was gone without putting any cover-up drugs into her body. Just took one treatment because she came right in the same day that she fell down while hiking, actually right off the trail. Is that correct?
Yeah, that's pretty much correct.
Essentially correct. Good.
Yep, and I think the important part is for the listeners to know I've been seeing you since 2016, and he has straightened my spine out. He's taken care of injuries that I've inflicted upon myself, being active. And I think if the listeners out there would just give you a try, and they'd be very pleased. So.
Yeah, that's great. I really appreciate that. And you have quite an education background yourself, don't you?
Yes, I do.
You're an administrator of education schools?
Yep.
Right. You were a principal or super, what was your job?
I was a teacher and a school administrator.
Yeah, that's pretty good, pretty educated. So you know a lot about life and about what to do.
Yeah, I would like to say that. Yeah, it's an ongoing process. I don't think we ever get there.
Yeah. We've had some good conversations in the office, and Dr. Wyrick's had some good conversations with you as well.
Yep.
Well, I really thank you very much for giving us your testimony today.
Thank you.
I think
See you
you're
next
absolutely
week.
fantastic. All right.
Okay, so let's get back to our kidneys here. And you might ask, do I have some example herbs and so forth that I want to share with the audience? And actually, I'd rather not go into detail because the choice of herbs depends on a number of individual factors, which includes the patient's diagnosed cause. Generally, several herbs are combined for a synergistic effect, a combined effect that's based on patient particulars. And, in addition, patients need to be closely monitored. This is not a do-it-yourself kind of project.
So let's circle back, Dr. Wyrick, and talk about more testing to get early diagnosis of kidney disease, because we want to start treatment as soon as possible before too many nephrons are irreversibly turned into scar tissue.
Well, the easiest test can be done at home with a urinalysis test strip that you can buy at your local pharmacy to look for blood or protein in the urine. That is a red flag that your kidneys may be suffering. Another easy test is to look at your urine in the toilet. Not everybody does that, but it's very illuminating. If it is all frothy, like a head of beer, that is a sign that there is protein in your urine and another red flag.
So are there any other tests that are useful in evaluating kidney function?
Well, there are several other urine tests that I like to see. There's a standard urinalysis, which is often ordered once a year as a screening test by many doctors. There is a more sophisticated test called the urine microalbumin, which is a more sensitive test that can be used if the patient has already been diagnosed with risk factors for kidney disease. And there's a 24-hour creatinine test, which gives a more accurate view of the glomerular filtration than the eGFR and lets us better stage kidney disease.
Well, what are the risk factors, Dr. Wyrick?
Well, the three most important causes of kidney disease are hypertension, which we'll talk about more in a little bit here, diabetes, and autoimmune disease.
What? We could do a whole show on any one of these.
Yes, and we don't have time for all of these, but let's talk a little bit more about high blood pressure, which is also called hypertension in medical language.
Well, what causes hypertension, Dr. Wyrick?
Well, lots of things. Number one, some people are sensitive to too much salt in their diet, but not everybody. We can do genetic testing to predict an individual's response to salt, or just do a salt elimination diet trial. But the key is to find the right amount of salt for you. Salt is an essential nutrient, and some people actually function better with more salt rather than what they're currently taking. And so, number two, some people don't eat enough fruits and vegetables to get enough potassium. Potassium has to balance salt. But this is tricky because in advanced kidney disease, people tend to have too much potassium in their diet, and potassium can build up because the kidneys aren't functioning well, and that buildup of potassium can cause a heart attack and sudden death. Stress can be a factor. Number three, we can help you handle stress using techniques like heart rate variability biofeedback training, which we've talked about in the past on this show, and that we offer that at Patient Health and Wellness Center. And my fourth cause of hypertension is, I need a gong or something, kidney problems causing fluid overload in the body. Thank you.
So wait a minute. You said high blood pressure causes kidney disease, and now you're telling me that kidney disease causes high blood pressure. What are you talking about? It's a dichotomy.
Well, yes, this is a problem that feeds on itself like a snowball rolling downhill that gets bigger and bigger. We have to interrupt this death spiral.
Are there any other causes of high blood pressure?
Well, there's many. Fifth on my list, for example, is excessive use of non-steroidal anti-inflammatory drugs like aspirin and ibuprofen, which are used to treat chronic pain. It's okay if you have a bump and use temporarily these kind of medications, but if you have chronic pain and try to medicate it with aspirin or ibuprofen, other NSAIDs, it causes problems. These drugs change prostaglandin levels, which in turn affects kidney function, as we talked about previously. Prostaglandins are one of the hormones that affect kidney function. And this in turn can lead to fluid overload in the body. And this problem has become worse in recent years because the government has been pushing people off of opioid-type pain relievers, so more people are consuming more NSAIDs as a substitute.
Rather than depending on drugs, whether they be NSAIDs that damage the kidney, acetaminophen that damages the liver, or opiates that have risk of addiction, it is best to treat the root cause of the pain using scientific, chiropractic, and naturopathic medical approach to each person's treatment.
Yes, we're almost out of time for this segment, but let's talk just a bit about how the naturopathic medical approach to treating high blood pressure used by naturopathic medical doctors, NMDs, like myself, Dr. Wyrick, and yourself, Dr. Gear, differs from allopathic medical approach used by most MDs, DOs, and nurse practitioners. In the allopathic world, there are very specific treatment algorithms. For example, one paper that I read from the American College of Physicians, published in 2018, scientific meeting, Columbus, Ohio, quotes the following 2014 JNC 8 guidelines, which is an official advisory committee used by allopaths a lot, which can be summarized as how to choose the best drug to start with from a list of different classes of drugs. I'm going to call out the names of the drug classes just to give you a flavor for the process, but don't stress out over all the jargon. Rule number 1, if the patient has chronic kidney disease already, start with an ACE inhibitor or an ARB, or angiotensin receptor blocker. 2, else, if the patient is non-black, start with a thiazide diuretic, an ACE inhibitor, a calcium channel blocker, or an ARB, angiotensin receptor blocker. 3, else, if the patient is black, start with a thiazide diuretic or a calcium channel blocker.
Well, this sure gets complicated, Dr. Wyrick.
Yes, but it's follow the number. You don't have to do a whole lot of thinking here.
Well, this is different than what we do, isn't it?
Well, it is.
We look at the whole person and figure out the cause, not just what are the symptoms and what drug can we give them to change the symptom.
Right. But I'm not done yet. We have
There's more?
Step number
Holy
4.
cow.
If adequate control is not attained with the drug that we chose first, add another medication from a different class listed above and repeat as necessary. And number 5, if you run out of the first-line drugs that I listed above, add in second-line drugs classes such as beta blockers, alpha blockers, aldosterone blockers, nitrates, and so forth, one at a time. So,
You give me a headache, Dr. Wyrick. I don't want to even listen to all this anymore.
but it's easy to follow by the numbers, isn't it?
Only if you don't want to look at that whole person.
So, anyway, this algorithm is based on the statistical evaluation of what works based on an average for a mixed general population. In other words, an arbitrary patient or 1,000 arbitrary patients walk in the door. If you follow this algorithm, on average, your patients will get better. But the only decision points here are whether the kidney patient has chronic kidney disease and what the race of the patient is. and whether the blood pressure has met the target yet. It will give the best overall results for a large pool of patients drawn from the general population, which is how insurance companies and government bureaucrats think, in terms of what is best for the collective population, not for the individual.
So the algorithm does not consider the cause of the hypertension or any other individualized decision factors other than a choice of two different racial backgrounds, which is a gross oversimplification of the variation physiology in the human race. This is not the way we naturopathic medical doctors think. We always try to identify and treat the cause of the problem for every person, every individual.
Yes, the naturopathic medical model requires more testing to diagnose underlying causes and more thought about how to design an individualized treatment plan. But it works better, especially for people who do not fall in the middle average of the bell curve used by the insurance companies and the allopathic doctors.
You know, when you say more testing, you also need to say more history taking.
Oh, yes.
Spending time to know the person.
Yes. If you go into the doctor's office, they take your blood pressure and whip out their prescription pad. They're short-circuiting the process a little bit.
So the take-home message from all of this is, if your allopathic primary care doctor, that's an MD, a DO, an NP, a nurse practitioner, or a physician assistant, is not succeeding in controlling your blood pressure, it's time for a second opinion from a naturopathic medical doctor who is trained to think outside the allopathic box.
So if you want to learn more about kidney disease or high blood pressure, call Payson Health and Wellness Center to schedule a free 15-minute consult. And that phone number is 928-474-7409.
You know, I just spoke with a lady today who has very high blood pressure running in the 200s, low 200s constantly. And it started after she went through a tremendous amount of emotional stress. And she's taken lots of different things to try and control it. And she's an excellent exerciser, but she has some structural problems, but that's not the problem. I found that she had this emotional stress underlying. So now we're working on finding the details. I gave her my homeopathic medical questionnaire. It's 1,000 questions long. You don't answer the questions, but if you find a question that applies to you as an individual, then you write down who, what, when, where, why, how. In other words, you give me a little biographical sketch of yourself in relation to that subject of the question. Once we have that information throughout all the different systems of the body, then I take that and I read it, and I become that person to the best of my ability, trying to find out where the common denominator is. And then I look to the homeopathic pharmacopoeia, find the most common possible answer to the whole persona of that individual, and then I use my applied kinesiology muscle testing to validate my choice or choices of the homeopathic medicines. And that allows me to do things that are impossible any other way. But it's very detailed, takes a lot of time, a lot of effort. But when nothing else works, sometimes that's the silver bullet. So, if you like this segment of our show and want to hear more like it, you should call us and let us know, as well as suggesting other topics of interest you'd like for us to discuss. So we're sure you've heard of our invitation for the free consultation we offer at Payson Health and Wellness Center. Do you think it's not important enough now for you to find out what can be done to help your brain function better, longer, more alive, without dwelling on the negatives of pain, depression, and the blahs, high blood pressure, kidney disease, chronic spine pain? When people with pain present for their free consultation, we find on examination the area of the pain shows either acute tissue reaction of tender, reddish, swelling, and warm feeling, or chronic pain tissue reaction of thickened tissue swelling, tenderness on light to heavy pressure, and poor movement of joints or soft tissue. Many people come with disc or discs of imaging, which we show on our 6-foot monitor screen for best viewing. X-ray imaging shows bony narrowing of the holes between the bones. MR imaging, that's magnetic resonance imaging, shows soft tissue narrowing of tissue spaces. The suffix algia, when you hear that, means pain in the distribution of a nerve, and the suffix itis means inflammation. Neuro means nerve, and myo means muscle. Bursa means fluid-filled sac that allows joint tissue to be protected from rubbing. Fascia means sheet of fibrous tissue between tissues or bundles of cells. Arthro means joint. Now, arthritis is inflammation of a joint. Arthralgia is pain of a joint. Fasciitis is inflammation of the fibrous tissue between the bundles of cells. Bursitis is inflammation of the fluid-filled sac. And go on and on and on with all these little definitional things. We have a caller. Hello, caller. You're on the air. How can we help you?
Hi. You're getting right on the area that I wanted to call you about. I just discovered that I have arthritis in my knees, and I found out because I had a bad fall about 2 months ago, and I wound up doing an MRI, and they said that the soreness I'm feeling, or the ache I'm feeling, isn't from the fall. It's really from arthritis that's forming. And I noticed that the back of my knees, especially, they were getting really tight. But my question I know there's 5 treatments, but also, are there certain foods that cause it to inflame, and what natural treatments can I see?
Okay, so you're asking what causes inflammation of the knees?
Is that behind the knees, you said?
Yeah, well, they tell me I have arthritis out there, and that's what the MRI shows.
Okay, are you here in Payson?
I am.
Okay, and you have x-rays and MRIs made?
I do.
Good. Here's what my suggestion to you is. Please, get your disc and bring it to us. Free consultation.
Okay.
When I look at the disc, I can tell you a whole lot more than I can on the radio.
Okay. Well, when I went to the orthopedic surgeon, because I thought I had really injured my knee, he suggested I get cortisone, and I've always been against getting cortisone, but I was in quite a bit of pain, and I did have the shot, and
cortisone
I don't want any more.
Cortisone is normally made by the adrenal glands of the body, and it's not a bad thing once, but it doesn't fix the underlying problem.
That's right.
And so we'd like to have a chance to see what that underlying problem is, and let you know I've seen lots of people with lots of degenerative changes in their knees by altering some of the weight bearing and some of the things that they're doing. We can make it possible for them to live many more years before they succumb to the knee problem. In fact, they might go the rest of their life without needing their knees operated on.
Well, I'll certainly give you a call tomorrow and see if we can get together again.
Great.
Okay, thank you.
You know the phone number?
I do. I have, yeah.
All right. You know where we're located?
And I know where you're located, yes.
Oh, great.
Okay.
Good. We look forward to seeing you.
I would definitely be in to see you. I need to get the disc from the doctor, but...
Well, where was the x-ray made, or the MRI made?
It was made... the x-rays were made about a month ago, and the MRI was done about 2 weeks ago.
Okay. Where was the location?
Oh, here at Banner Imaging.
Okay, it's real easy. You just call them up, tell them to make a disc for you, and then you want it for Dr. Gear, and you pick it up at the hospital, and you bring it over to me. We put it up on our 6-foot screen, put it in the computer, and it goes up on the 6-foot screen, and then we have a chance to really see all the details.
Oh, okay, cool. That sounds great. I'll do that tomorrow then.
Great.
Okay, thank you.
You're welcome. So, that's awesome. So, Dr. Wyrick, we have this testing that you do that helps people come up with their emotional intelligence. That's a key to a longer life. So, when we think about what we need to do to live a long, healthy life, many of us probably think about the foods we're eating, the supplements we're taking, and how we exercise. Sure, all those are important, but a group of researchers who've analyzed long-term studies of how people age have come upon another key factor you need to incorporate into your life that often trumps the important things I just mentioned.
So what is that key factor?
Well, they point to what's called emotional intelligence. What's that? It's the ability to accurately identify and deal with your own feelings while empathizing with and understanding the feelings of others. To put in more down-to-earth terms, it's being in touch with your own feelings and sensitive to those of others. Added to the mix, emphasizing positive emotions over negative ones, and embracing gratitude for the good things of your life, being optimistic and hopeful.
So, is there proof that these things can add years to your life?
Well, there's a researcher called George Vallant who headed up a study called the Grant Study that's been examining the longevity and health of a group of Harvard grads since the 1920s. According to his findings, if you want to live to a ripe old age, you should worry less about cholesterol and more about gratitude and forgiveness. That was published in the Harvard Magazine, 2019.
Well, personally, I don't put any stock in cholesterol as a measure of your health anyway. I put a lot of stock in forgiveness and always looking at the bright side of things.
So is there any relation to emotional intelligence and the aging heart?
Oh, yes. Among the Harvard grads in the Grant study, Dr. Valiant found out that not smoking, having a stable marriage, exercising, keeping your weight down, and not overdoing alcohol, along with the emotional intelligence, all contribute to better aging. But there's a caveat. He adds, what's critical is allowing yourself to love others and being able to take people in, as in, I've got you under my skin.
Or I've got your back.
Yeah, I like that one better. So he's not the only one who thinks so. Other researchers have found that emotional intelligence contributes to factors that help you live longer, and scientists are able to measure these. For instance, work at the University of Arizona shows that emotional intelligence can help lead to a better heart health as you age, and that's a topic that is near and dear to my heart.
So, there is published research on this subject of emotional intelligence. It was published in the government publications of the NIH, National Institutes of Health, and we have all that citation available for anybody who wants to look at it.
Yes, I will be putting that up on drwyrick.com in the multimedia archive section.
So these investigators define emotional intelligence as an awareness and grasp of your own emotions and the emotions of others around you, which is pretty much the way I defined it at the start of this piece. They add that it entails being able to use that emotional awareness to improve both your life and the lives of your friends and relatives.
When it comes to your heart, we also found that this kind of emotional awareness, we'll have to talk about further time. We're running out of time.
So we're going to talk about this more on our next show, along emotional awareness, along with some other things. And Dr. Wyrick, you've got a test ability in the office that you use to help people understand their way that they think and the stress in their lives.
You're talking about my heart rate variability test.
Yes, I am.
And that's a computerized program that not only evaluates your current state, but it helps you to improve your ability to handle stress.
It'll take 10 years or 20 years of meditation and put it into just a couple of months.
Absolutely.
So, Mike, thank you so much. This has been a great show, I think, today. I hope everybody listening enjoyed it as much as we enjoyed bringing it to you and the research that we did to bring it. So, everybody, we're going to continue on next week on this emotional intelligence and other things. Great having you here.
All right, and remember, go to our website, KMOGcountry.com, for copies of this program. As a matter of fact, as of tomorrow, late in the day, we'll have an archive of all the past programs that you can access on there, KMOGcountry.com. And thank you so much for listening. We'll see you next Tuesday night, same time, same station.
You've been listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.